The bones of the viscerocranium, except the mandibular condyle, is formed by intramembranous growth. It is very important. Mandibular condyle is formed by the it is not formed by intramembranous growth. It is formed by endocaudal ossification. Now the anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. The anterior cranial fossa is formed by frontal and ethmoid bone and parietal bones. The contents of anterior cranial fossa are the frontal lobes, cribriform plate, foramen cecum, and crista galli. Middle cranial fossa is formed by sphenoid and temporal bone. Its contents are temporal lobes of the cerebral cortex, pituitary gland, optic foramen, superior orbital fissure, carotid canal, trigeminal ganglion, foramen rotundum, foramen ovale, and foramen spinosum. Then you have the posterior cranial fossa, which is formed by the occipital and temporal bones, and this fossa contains occipital lobes of the cerebrum, brainstem, cerebellum, internal acoustic meatus, jugular foramen, foramen magnum, and hypoglossal canal. So you can see here, this is the anterior cranial fossa. This much is your anterior cranial fossa. This much is your middle cranial fossa. And this much is your posterior cranial fossa. You can see the contents here. Okay, foramen cecum, cribriform plate of ethmoid, then orbital part of frontal bone, then lesser wing of sphenoid. This is the lesser wing of sphenoid. This is the greater wing of sphenoid. This is the greater wing. This is the lesser wing. Okay. Then other contents of anterior cranial fossa is frontal crest, crista galli, anterior ethmoidal foramina, and then posterior ethmoidal foramina. All these are present in the anterior cranial fossa. Now the contents of middle cranial fossa, you have so many foramens, foramen rotundum, then you have the optic canal, then this is the hypophyseal fossa where the pituitary gland is situated, dorsum sella, posterior clinoid process, anterior clinoid process. Then in this part you can see superior orbital fissure is here. There is an opening here, superior orbital fissure. Then foramen lacerum is here, foramen ovale in the shape of an oval. This is the foramen rotundum. So all these are contents of middle cranial fossa. Foramen spinosum is here. So there are 4: foramen rotundum, foramen ovale, foramen lacerum, foramen spinosum. And you have the trigeminal impression here, where here what lies is the trigeminal ganglion. Then you have sulcus of the superior petrosal sinus. So this is your middle cranial fossa. Okay, then external aperture, vestibular aqueduct. This is the mastoid foramen,